When it comes to staying healthy, we all know lifestyle habits and staying on top of doctor's appointments play major roles. Yet, about only 3 out of 5 men actually get a yearly checkup. We want to talk about it because June is Men's Health Month, and Dr. Scott Joy from HCA HealthONE Physician Services is here with me now to talk more about the growing concerns, and it is an important conversation we want to have this month. Why do you think it is that men just aren't as, readily making those appointments for themselves?
No, I think there's clear data saying that men are less likely than women to come in for preventative visits. So we want to make sure that we're making a welcoming environment for men to come in. Make sure that they understand we're looking in their best interest, looking at their mental health, their cardiovascular health, cancer screenings, and just build that relationship over time so they're comfortable coming into our office.
It's so important. And you mentioned a couple of other things outside of just the yearly physical, the checkup. What other things should men be thinking about?
Yeah, I think one of the biggest opportunities for men is to improve their cardiovascular risk factors. So when men are in their late 20s, early 30s, good time to get your cholesterol checked. Also, when you're 18 plus, and even when you've been in pediatrics, to get your blood pressure checked as well. And we've got some really nice calculators that we can use those cholesterol numbers in. And before we used to say, what's your target cholesterol number? Now we know, we have a calculator to know what your prevent score is. And that allows us to kind of look at someone's risk anywhere from 30 to 80, what their risk of vascular heart disease is and how we can intervene to make a difference.
Wow, just the way technology has changed and what you're able to actually do. I am curious though, when you see patients come in, I think of Colorado being such a healthy state, people are active and out and about, but what are some of the bad habits that you see most often when you see your patients?
Yeah, I think some of the bad habits are a little bit too much alcohol use on a daily basis. So definitely if we can get our patients, our men to decrease alcohol intake, that's very important. Less people are smoking these days, so that's important. But a sedentary lifestyle. Now you mentioned about the Colorado lifestyle, very active. We're looking for a physical assessment vital sign. And that's about 150 minutes of movement per week. So to make it a little bit easier for men to come into the clinic, we don't mention the word exercise. We say, how much movement are you doing? A little less threatening, talking about how can you move 150 minutes per week.
Okay. So people who are sitting out there like, oh, I probably do need to make an appointment, but I'm busy, I'm tired. I know even sometimes it's hard to get in with if you do not have, your regular doctor. Sometimes you can make that call and they don't have an opening for months at a time. But what can you say to folks that just like, okay, that sounds like a bunch of excuses. Get in there, get your appointment.
Yeah, I think don't give up, primary care. We're hiring more docs this year and we're training more residents. So we are definitely working on improving that workforce to improve access to men coming in for their important physical, and really more of a preventive visit these days, more than a physical head-to-toe exam.
Yeah, stay on top of it. Dr. Joy, we appreciate you.
Yep, thank you.
Thank you so much. We'll be right back.